I just want to introduce myself. I'm Bahar Adavudi. I'm the Vice President of MCHSA, and thank everyone for joining us for this wonderful seminar. I know we might have a mixed crowd, so if you aren't a student or don't already follow us, please, you can find us on social media, Instagram, Facebook, Twitter, and the links to our Engage page and other events will always be on there. We'll advertise it on there too. So for anyone who's interested in more things like this, give us a follow. And I'm going to hand it off to Vicki to introduce our speaker.
So we just want to welcome everyone to the importance of car seat and booster seat safety seminar. Many people may be unaware of this, but vehicle crashes are one of the leading causes of death and injury for children in the United States. And a lot of these deaths can be prevented by just ensuring that children are in their age appropriate and seating arrangements. So there's a lot of information about there and misinformation about car seat and booster seat safety, which can confuse and overwhelm parents as well as just the general public. And there are a few organizations that are there to offer support to parents who do have questions and concerns, but due to the pandemic, the assistance that they can offer has been limited. So our wonderful speaker today is devoted to helping us learn more about how we can protect our children and our family members. She has been in the maternal and child health field for over 6 years. She has received her master's with a concentration in community health, and she is a certified child passenger safety technician with Children's of Alabama. I'm sorry, Danielle. That's all. I always get tongue-tied over that one.
I know, it's a mouthful.
Yes. So please help me welcome Miss Danielle Weeks.
Well, hello, everybody. So just to kind of piggyback off what Vicki said, my name is Danielle Weeks. I've been with Children's of Alabama for 3.5 years as a certified child passenger safety technician. So we focus on everything, as the name says, child passenger safety, car seat safety, booster seat safety, teen driving, concussion, anything that has to do with child passenger safety. We pretty much cover it. The title of my seminar is The Importance of Car Seat and Booster Seat Safety and Education. And like I said, I'm Danielle Weeks. I'm an assistant child passenger safety program coordinator at Children's, and I am a certified child passenger safety technician. So some of the things that we are going to be discussing today. So I'm going to start off with some data and statistics. Then I'm going to discuss the 2 main ways to install car seats. That's with seat belts and with the latch system. Then I'm going to give an overview of the different kinds of car seats. That's really going to be the bulk of this presentation today. There's a lot of different types of car seats for different developmental ages, heights, weights. So we're going to get into all that. I'm going to discuss some of the common installation and harness and errors that we see. I'm going to end with some resources, and then I'll open up the floor for questions, or if anybody has any questions or comments, anything in between, just feel free to unmute yourself if there, because it is a lot of information. So I'm going to try not to bombard and to bore y'all, because it can be a lot of information. So here we go. Okay, so just so I kind of touched on this already. So at Children's of Alabama, we are the Health and Education and Safety Outreach Center. We are formerly Alabama Safe Kids, which is a coalition of Safe Kids worldwide. So we have 4 overarching umbrellas that we focus on in our department. That's transportation safety, home safety, school safety, and trauma safety. Myself and my coworker Jennifer, we cover the transportation safety umbrella. So these are some of the programs that we offer. So we have our car seat clinic. So in a pre-COVID world, we used to host our car seat clinic, which we would do every other Tuesday in our parking deck. So basically, parents could call our car seat phone line, and if their child was on some type of government assistance like WIC, Medicaid, food stamps, all kids, they can make an appointment with us, and they would come. They get a brand new seat fresh out the box. We teach them how to harness the child in the car seat, how to install the car seat in their car. So that's really was a large part of our program before COVID. Unfortunately, we haven't had a car seat clinic in almost 2 years, and I hate it because we haven't been able to help a lot of people. We teach CPS CPST certification courses. So a lot of nurses, like in the NICU at Children's, firemen at different fire stations across Birmingham, they'll come to our classes to get certified. Our car seat line, as I mentioned, that parents can call to make an appointment to come get a car seat. So that's just kind of an overview of our department. Everybody who works in our department is a child passenger safety technician, or they are either an instructor. So just to start off with a few data and statistics. So as Vicki mentioned in the introduction, motor vehicle crashes are the leading cause of preventable death among children in the United States. And some of these stats it's really shocking. So in 2019, there were 646 deaths and 6,128 hospitalizations of children ages 0 to 12 from motor vehicle crashes, and an additional 95,237 children visited an emergency room due to motor vehicle crashes. Majority of the deaths, as you see, were females, 52% of females, 48% males. Children ages 4 to 7 had the greatest risk of death at 1.32 deaths per 100,000. Some more statistics. So children killed, I focus on passenger cars just because that's what children ride in majority every day. They had it broken down by like trucks, buses, but I just chose to focus on passenger cars. So in 2019, children less than the age of 5, there were 139 killed. There were 125 children killed between the ages of 5 and 9, and 194 killed between the ages of 10 to 15. And when it comes to injuries, it's way more. So 23,000 children less than age of 5 were injured in passenger cars, 32,000 children between the ages of 5 and 9, and 44,000 between the ages of 10 to 15. More than 1 in 3 children who died as an occupant were unrestrained. And on an average, 3 children are killed and an estimated 407 are injured every day in the United States due to motor vehicle crashes. Whenever a child seat is used correctly, it can reduce the death of a child by up to 71%. Whenever a booster seat is used correctly, it can reduce the risk of serious injury by 45% for children ages 4 to 8. When compared to those children being in just the seatbelt alone. And we'll discuss that later, why children this age need to be in a booster seat. And over half of child seats are installed correctly. So the bottom line of all these stats is whenever child seats are used correctly, they can save lives. So now we're going to go into the 2 main ways to install car seats. So the way that most people are probably most familiar with, or probably think about the most, is with the seat belt. So whenever we install a car seat with the seat belt, that seat belt needs to remain locked at a fixed length. All that means is that it needs to remain locked at that same length for the entire time that the child is traveling in that car seat in a vehicle. The lap portion of the seatbelt has to remain locked at all times, and any vehicle made after 1996 is required to have seatbelts that lock. That is called the lockability requirement, and I'll get into that in a little bit. So there's 2 main types of seatbelts. So we have the lap belt. So the lap belt, or 2-point, because it offers 2 points of protection. So it contacts the body at 2 places, 1 at each hip. It does not provide any type of upper body protection because it simply just goes across the lap. And then we have a lap and shoulder belt, which is probably what most of us are most familiar with, what we use in the car every day. Hopefully y'all are using y'all seat belts. And it's called a 3-point because it offers protection at 3 points. So we have the protection, those 2 points at the hip, and then we have that added point up here at the shoulder. And this is going to provide upper body protection. So when we talk about installing car seats with the seat belt and getting the seat belt to lock, there is something called a retractor. So the retractor is a part of the seat belt that we engage that is needed to secure the car seat into the car. So there's 3 different types of retractors. The first is an emergency locking retractor, and it is exactly how it sounds. It locks in an emergency. So anytime there's a sudden stop, acceleration, turn. So let's say you get in the car, you're late in the morning, and you're trying to put your seatbelt on, you yank it real fast and it doesn't come out. That is the ELR doing its job, because it's thinking that there's some kind of emergency or something because you're jerking it so fast. So that is what an ELR does. It locks in the case of an emergency. Automatic locking retractors, these are present more in older cars. We don't really see these as much in newer cars. But basically with an automatic locking retractor, it has to be pulled out the webbing of the seatbelt has to be pulled out a certain amount before that locking retractor engages. So typically 12 to 18 inches. These can be a little tricky because you can pull it out and you may think that it doesn't lock. So that we call that area the dead zone, but you just have to pull that retractor out a little bit more. So the most important thing about retractors is it comes down to, does it lock or does it not lock in order for us to be able to secure a seatbelt? So like I said, an emergency locking retractor, you cannot use that to install a seatbelt without having to use an additional step. An ALR, you can use that to secure a seatbelt, like I said, even though they're not as common anymore. And I actually have a little video. It's a little 58-second clip. Can y'all see this, YouTube? Do y'all see this video?
Yes.
Okay, all right, so I'm gonna play this. It's 57 seconds. It just kind of explains the difference between an emergency locking retractor and an automatic locking retractor.
An automatic locking retractor is found in the rear seat of some older cars and the front seat of some much older cars. And basically this retractor locks based on how much webbing is extended from the spool. So as you can see right here, it's not locking, but as you extend maybe 20 to 25 inches off the spool, it begins to lock. And it will continue to lock as the belt ratchets down until it fully retracts, at which point it's ready to extend again. There are multiple varieties of emergency locking retractors, but basically they lock either when the webbing has been extended quickly, as in a crash, or they may also lock based on how the retractor is oriented. So for example, you can see that the webbing extends freely until the retractor is tilted, at which point it's now locked.
So that I found that video, just Google search, and that just gives a real simple, thorough explanation of the difference between an emergency locking retractor and an automatic locking retractor. Can y'all see the slides again?
Yes.
Okay. All right, so the last type of retractor is a switchable retractor, and it is self-explanatory. It's called a switchable retractor.
Made it down to North Carolina. We're in, this is
goodness.
Keith's man cave.
Sorry, this started automatically playing. I should probably close YouTube, sorry. Okay. So a switchable retractor is exactly how it sounds, because it has the ability to easily switch from emergency locking mode to automatic locking mode. This is the most common type of retractor. This is what is found in cars nowadays. It's like, especially in the back seat, is going to be a switchable retractor. And this does provide the necessary lockability in order to properly secure a car seat to the seat. So the second method of installing car seats is the lower anchors. Or the latch system, which stands for lower anchors and tethers for children. So people have probably seen these symbols in their car, and if you don't have kids or have car seats, you probably are like, what the heck is that? So that is a part of the latch system. So the system consists of 2 lower anchors, which are these hooks that are located in the backs of the seats, and top tether anchors, which if you have a sedan, they're going to be on like that back shelf that's right in front of your the back window. So that is what the latch system is. And cars made after 2002 are required to have at least 2 complete latch systems. So if you have a newer car, you are going to have these latch in your back seat, or if you have an SUV, your second or third row. So latches are usually located in the outboard seating positions. All an outboard seating position is that's just the seating position that is closest to the window. Whatever seating position is not in the middle. And when in doubt, if you don't know where, if you have lower anchors or where they're located, always check your vehicle owner's manual. So the first part of the latch system is these lower anchors. As I said, those are these metal bars. So there are lower anchor connectors, which I'm going to talk about that in a few slides, that are on that are on car seats, and that is what connects to these right here. So they may be visible like they are here. You can clearly see these lower anchors, or they may be hidden by like a door or some fabric. But if they are hidden, they will be clearly labeled with this little symbol right here. So you'll know that there are lower anchors located behind this. The second, that second part of the latch system consists of the tether anchor. So this is more common on forward-facing car seats, which I will discuss in a little bit later. But this is what limits the forward head movement of a forward-facing car seat. So cars made after 2000 are required to have these latch. There's a few exceptions, like right here, convertible cars, large vans, and some school buses. And then these are some of the locations where you might find the tether anchor. Like I said, if you have a sedan, it'll be on that rear shelf. In a pickup truck, it might be on the back wall. If you have an SUV or a hatchback, it might be on the bottom floor of the cargo area, so like of the trunk. If you have a car that was manufactured before 2000 and you can take your car to a dealership and you can actually get your car retrofitted for the latch system. And just like the lower anchors, the tether may be hidden, but if it's hidden, it will be clearly labeled as you see right here, and it will let you know that there is a tether under that flap or door or whatever might be hiding it. So these are lower anchor connectors. So these are what connects to those lower anchors that are in the seat back. So there's two types of lower anchor connectors. We have rigid, they're attached to a metal frame. The metal frame, they are rigid, they do not move, you cannot adjust them, or they may be flexible. So you see here, they're attached to this webbing and those can be adjusted. You can use lower anchors rear or forward facing. Usually using the latch is easier rear facing. Sometimes we do install a forward facing seat with latch, but it's usually more common in rear facing. So just a few installation tips to remember, especially when it comes to latch. So the thing about latch system is that there is a weight limit. So you never want to install latch that has a weight limit of 65 pounds, and that is the combined weight of the child and the car seat. So if your car seat weighs 20 pounds, if your child is 40, 45 pounds, then using latch might not be the best, because they're going to be right there on that top end of the weight limit. Whenever you are wanting to install the latch, particularly in the middle seat, you just always want to check the car seat manual and the vehicle owner's manual to see if you can borrow latch. So what I mean by borrow, let me go back. So let's say you want to put your baby's car seat in the middle seat. So you might think, oh, well, I can use this latch from this seat, and then I can use this latch from this seat. But that might not always be allowed. So we always just say, check the vehicle owner's manual and the car seat manual to see if you are allowed to. That's what we mean when we say borrow, when you're using lower anchors from two different outboard seating positions. Okay. And this is something that we see all the time. And when we tell parents or people in general, they are shocked because they think that it's like double the safety. You never install a car seat with the latch and with the seat belt. It's either or. They're both equally as safe. One is not safer than the other, but we tell parents that. They're like, oh, I did it with the latch and the seat belt, double protection. No, no, no. There are maybe a handful of seats where that is allowed, but typically that is not allowed to install with the seat belt and the latch. So as we always say, check the vehicle owner's manual and the car seat manual. So now I'm going to get into the bulk of my presentation, and that is, what is a car seat? So this is textbook definition right here. A child safety seat, car seat, child restraint, they're all interchangeable. I'm going to use car seat because that's the term that most people are familiar with. So it is a device that has been crash tested and specially designed to provide protection for an infant or child in the event of a motor vehicle crash. So there are different types of car seats, and the different types of car seats vary for different age, weight, height, and developmental levels of the child. So car seats, a correct car seat is one that is within the child's age and weight and height, but age and weight are typically the two most important factors when it comes to deciding the right car seat for your child. So the first type of car seat I'm going to discuss is a rear facing only car seat. So I'm sure everybody has seen, at least I know everybody has seen these at least. So this is a rear facing only car seat. So we have a rear facing only car seat. We have one with the base, and then we have a rear facing only car seat without the base. A rear facing convertible, that is this seat right here. So it can be used rear facing, and then it converts when the child reaches the maximum weight and height requirements for rear facing, and it can convert and go forward facing. And then we have a rear facing all-in-one. So that's this seat right here. So an all-in-one seat can be used rear facing, then it can be turned around and used forward facing, and then you can remove these harnesses and it can be used as a booster. So it's every car seat in one. It lives up to its name. It's literally all in one. So the most important thing about rear-facing car seats, and especially for newborns, infants, is for head and neck control. So as we know, babies, they have no kind of control of their head and neck, but as they grow, they'll gain more control. So the reason why keeping them rear facing is so important is because it supports their head and neck in the event of a crash. So we preach all the time, children need to remain rear facing until they are 2 years old, and then, or they need to remain rear facing as long as possible within the particular weight and height limits of the seat. And children who have poor head and torso control, so maybe there may be a child that has like muscular dystrophy, or maybe it's premature and is maybe lagging developmentally, they could benefit from staying rear facing long as possible, because it's going to give them that extra head and neck support that they need. So there are some steps that we use when using rear-facing car seats. So the first step is selection, choosing the right seat. So when we say choosing the right seat, you want to choose the seat that is most appropriate for that child's height, weight, and developmental level. You want to choose a car seat that fits into the vehicle, the caregiver's vehicle. Car seats are not one size fit all. We've been in plenty of car seat clinics where it's like a puzzle trying to figure out, like, okay, it doesn't fit right here, maybe it can fit right here. Or the parent may have 2 or 3 different seats, so we're trying to install in like the back of a Camry, and it's like, it really is like trying to figure out a puzzle. So just whatever car seat fits best in the vehicle, and you need to select a seat that you can use correctly every time, especially if it's a seat that's going to be moved from mom's car to dad's car to grandma's car. The caregiver needs to be able to use that seat correctly every time. So installing it, reinstalling it, if they need to adjust the harness, anything, just select the seat that the caregiver feels like they are most comfortable using correctly every time. So the second step is direction. So as we preach, or as I'll say, you'll hear me say a lot, a child needs to stay rear facing until they reach the maximum height and weight limits defined by that particular seat. Any infant under the age of 1 needs to be rear facing regardless. And it drives me crazy because I have seen people with like 8-month-old babies forward facing, and I'm like, oh my God, no. And there are a lot of states that require that have laws that define how long a child should be rear facing. And here in Alabama, a child can be can stay rear facing and go forward facing when they are 1 year old or at least 20 pounds. The next step is location. So you want to choose an appropriate location in the vehicle. So whenever you are deciding where to install the car seat, you always want to install it in a seat that faces the front. I feel like this isn't as relevant anymore, but I guess, I guess like the 60s or the 70s, there were those seat positions where they could like swivel around and they can face the back. I never understood the point of that anyway. I feel like that would make me super car sick. That's not the point, but so you never want to install a car seat in a vehicle seating position that does not face the front of the car. You never, ever want to place a rear facing only car seat in front of an airbag. So like in the driver's or in the passenger seat, because that will kill or severely injure a child in the event of a motor vehicle crash. And if that airbag was to deploy. And of course, you want to check the vehicle owner's manual to see if that car seat can be installed in a seating position that has an inflatable airbag. So that's what this picture is. I know people are probably looking like, what the heck is that? But an inflatable airbag, or I mean, an inflatable seat belt is pretty much a seat belt and an airbag all in one. So in the event of a crash, if the seating position, if it is an inflatable seat belt, basically the seat belt will inflate like an airbag to just offer the passenger extra protection. And Ford, I know, is a company that has these inflatable seat belts in quite a few of their cars. So that's what this is. But like I said, just check the vehicle owner's manual and the car seat manual to see if the seat belt can be installed in the position that has an inflatable seat belt, or to see if your car even has inflatable seat belts. So you never ever want to install a car seat in a cargo area. So like in the trunk, or which there's a lot wrong with that anyway, but I guess particularly like an SUV or a hatchback, you never want to install a car seat in a seating position that is designated as a cargo area where there's not any type of seat belt or lower anchors or anything for you to secure the car seat. So I kind of mentioned this earlier. So especially people with their babies, there's a perception that the middle seat is always the safest. So we have parents that want to just automatically put their child in the middle seat. This is not necessarily true. They think that that is the safest because it's furthest away from any kind of point of impact in the event of a motor vehicle crash. So if you do have a parent that's just adamant, like I want to put my child in the middle seat and I want to use the latch, just once again, just check that vehicle owner's manual to see if you can borrow or just to make sure that that's suitable for installing that car seat in the middle seat. All right, so the next step is harness. So we have our cute little buddy here. He's going to help us demonstrate the proper harnessing when it comes to rear facing. So what we tell parents at our car seat clinic or any event that we have is you want to place the child with their butt all the way to the back of the seat. And one of the most important things about rear facing is the harness. So whenever we have a child that is rear facing, their harness strap should be at or below their shoulders. So all that means is that wherever the harness enters behind their back, it needs to be in a position that is below their shoulders. We want to adjust this buckle strap right here that is in the closest position to the child without the child sitting on it, because if the child is sitting on it, then that means that we're not going to be able to correctly buckle the buckle strap. So this strap right here needs to be as close to the child as possible without being underneath them. We want to place our chest clip at armpit level. So never right here down on the baby's soft tummy. You don't want to put it up here. That'll be too close to the baby's neck. Always, always, always at armpit level. And this right now is really relevant, especially with it being so cold outside. So I know a lot of parents want to keep the big bulky jackets or blankets on when they harness the child in. So anytime you harness the child in, you want to take off any blankets, any extra layers, because that harness is not going to fit on the child as it should with that big bulky jacket on. So what we tell parents parents, caregivers, is to take off that big bulky jacket, take off those blankets, harness the child in, make sure, like I said, everything is, harness at or below their shoulders, chest clip. And once you get the baby harnessed in, then you can place the blankets or the jackets over the child. Okay, and our last step is installation. So there are a lot of steps to go into installation. I wasn't going to go into all that detail, but the most important thing about installation with rear facing is we always want to make sure that I'm getting ahead of myself, excuse me, I'm sorry. So whenever we install the car seat, whether it be with the seat belt or the latch, the car seat should not move more than an inch at the belt path. So what we tell parents is, so this is the belt path right here. This is a forward facing, but I'm just showing y'all this since it's right here. So wherever the seat belt or the latch webbing belt path is, we tell parents you want to take your non-dominant hand. So I'm right-handed. So I would take my left hand and I would put it at that belt path, and I'm going to pull from side to side. So whenever I pull, that seat belt, that car seat should not move more than an inch from side to side. If it moves more than an inch, then we need to go back in and tighten it up until we have less than an inch of movement from side to side. That's how we know that our car seat is installed correctly in the vehicle. And a big thing for installation with rear facing is the recline angle. So these are some different types of recline angle indicators. So we have this little bubble indicator right here where the bubble is between the lines. We have our wheel indicator. As you see, we should see all blue. We don't want to see any red. That means our angle is off. Our ball indicator, just our ball needs to be right here in the blue. We don't want it in any red because that means it's not reclined far back enough. And then we have our line indicator. So this line needs to be parallel to the ground. And we also tell parents whenever checking for recline, whenever you're checking the recline angle, always make sure that you are on a flat level surface. So you don't want to be on like any kind of hill or any kind of incline. That's going to throw off the recline angle. So always on flat level ground when you check the recline angle. So these are some of the most common errors that we see when it comes to harnessing with rear facing. So as the harness is too loose. So what we like to tell parents with the harness, we like to say it should be as snug as a bug in a rug. And how we test that is we do the pinch test. So basically when you run your fingers across the webbing, like this person is doing right here, we should not be able to pinch any of this extra webbing between our fingers. So if we can pinch any webbing between our fingers, that harness is too loose. So we'll just pull our harness tightener and then we'll test again. So now this person's fingers just slipping right off the webbing. That's how we know that the webbing is tight enough. And I mentioned this earlier, the chest clip needs to be an armpit level. We don't want it to be too low because then it's on that baby's soft abdomen. No kind of protection there, or it's too high, too far up on the baby's neck. The harness straps are twisted. Our harness straps should look like this. They should be flat. They should be even. They should not be twisted like this. And the harness straps are above. So you see, I don't know how well y'all can see this, but you see right here, these harness straps are entering below this child's shoulders, and versus here, you can clearly see they're entering above the child's shoulders. So these are just some of the most common harnessing errors that we see when it comes to rear facing. Some of the most common installation errors that we see is a lot of incorrect routing. So here, this seat belt is just wrapped around the car seat. It's not anywhere near the belt path. Our lower anchors are attached upside down. So we tell caregivers that in order for the shark to eat, its mouth needs to be down. So in order for you to connect that lower anchor connector to the lower anchor, this little hook right here needs to be down. So shark mouth down, hook down. That is the way that the lower anchor connector should be connected to the lower anchors. And then right here, there is no room between the car seat and the driver's seat. It is touching the back of the seat. We say that there needs to be room because in the event of a crash, there is no give right here. Some car seats allow it, but as we always say, just check the car seat and the owner, the car seat manual and the vehicle's owner manual to see if they can touch. But we usually tell parents you want to have some space in between here. Okay, so the next type of seat are forward-facing car seats. So there are 5 different types of forward-facing car seats. So we have our forward-facing convertible. So just like a rear-facing convertible, it can be used for rear-facing, and then it converts and can be used forward-facing. We have a combination. This is a combination seat right here. This one is forward-facing. It can only be used in forward-facing only with a harness, and then you can remove this harness when the child reaches the weight limit, and that can be used in booster mode. We have our forward-facing all-in-one, just like the rear-facing all-in-one. It can be used rear-facing, forward-facing, and then you can remove that harness. It can be used in booster mode. We have our forward-facing only seats. So it's exactly how it sounds, just like rear-facing. It's only used forward-facing. And then we have our integrated built-in seats, which is a forward-facing seat that is built into the car seat. So parents are always curious, especially, you know, if their child turns 2, they're always eager, like, well, I want my child to be forward facing. A lot of times it's just so they can see the child, or a lot of times parents are like, they are concerned about their child's legs being kind of scrunched up against the back of the seat. So we have this good, better, best practice when we talk to caregivers about deciding if it's time for them to move their child from a rear facing seat into a forward facing seat. So this is good. Okay, so our child, let's say we have a 2-year-old and they're 35 pounds or whatever it may be. So they are at the minimum age, weight, and height requirements for the seat, for a forward-facing seat, but they also are still meeting the height and weight limits for their rear-facing seat. So, I mean, yeah, that's good. We can turn them around. That's fine. So we have better. So they are within the rear-facing weight and height limits of their car seat as allowed by the car seat manufacturer, but they also are within the forward-facing age, weight, and height limits of the car seat. So, you know, they technically meet both requirements. So, you know, that's better to turn them around. But best practice is to keep that child rear facing until they reach the maximum weight or height limit as allowed by the car seat manufacturer. So the steps for using rear or forward facing car seats are the exact same as rear facing. There's just 2 key differences. So that first key difference is that harness strap. So as I mentioned before, whenever we are rear facing, our harness straps need to be at or below the child's shoulders. But when the child turns forward facing, their harness straps should be at or above their shoulders. So basically, their harness straps should fit how our seatbelt does, how our seatbelt enters above our shoulders. That is how their harness straps need to be when they get moved forward facing. And the second is that whenever you use a forward facing car seat, it always needs to be tethered according to the car seat and the vehicle user manual. As I kind of briefly mentioned earlier, the point of us tethering forward facing car seats is to limit the forward movement in the event of a motor vehicle crash. Using the tether can limit that movement by 4 to 6 inches. So like I said, all the steps are the same. These are the 2 main differences. So some of the comments, this slide is super boring, y'all. I'm sorry. I Google and I could not find any pictures of these errors. So I'm sorry. It's just words. It's boring. It's not exciting like the other one. So a lot of the errors that we see in rear facing are the same, like the belt is routed in the wrong place. The harness is frayed. It's twisted. But the main difference that we see when it comes to harnessing between rear facing and forward facing is that those harness straps are not above the child's shoulders. They're still being used below the child's shoulders. And a lot of the installation errors are also the same, but the most common installation errors that we see between rear facing and forward facing is the tether. So either the tether is not used, the tether is misrouted. So instead of it being underneath the vehicle, the headrest is going above it or whatever, if it's not supposed to be like that. And sometimes the tether is the only thing that is installed, that is the car seat is installed with. Sometimes the seat belt isn't even used, it's just tethered. And we're like, oh God, that is offering no kind of protection. So these are some of the most common errors that we see with forward facing. So the next type of car seat is a booster seat. So there are two types of, and boosters, real simple, real straightforward. There are two types of booster seats here. We have our high back, self-explanatory because it has a high back, and then our backless here, there's no back. And then we have those, as I mentioned twice before, we have our combination car seats and our all-in-one car seats. They can go from rear facing to forward facing to booster, or from forward facing with that 5-point harness, and then you can remove that harness and use them in booster mode. And then we also have, just like we had those integrated seats with forward facing, there are also some integrated booster seats. So booster seats is in the name. The point of a booster seat is to help boost the child up correctly so that the seat belt fits them as it should. Seat belts were not designed for children. They were designed for adults. So that is why if you move a child into a seat belt too early, why that seat belt is not going to fit them correctly, because it's not designed to fit their little bodies yet. A booster always needs to be used with a lap and shoulder belt. I'm going to harp on this. You're going to hear me say this again. Always, always, always use a booster seat with a lap and shoulder belt. So whenever we have a child who's not in a booster and who's just sitting in the car seat, so basically, as I said, that seat belt is not designed to fit them. So instead of the lap belt portion being across their hips, it's up on their stomach. And that can increase the risk of severe abdominal injuries. That's something called seatbelt syndrome. I'm going to touch on that in a little bit. So high back boosters, the great thing about high back boosters is they're going to provide head, neck, and back support for the child. And this also might be an easier transition for children because it's a similar environment to what they're used to riding in with a rear facing or forward facing car seat. The only thing that's missing now is that tether. So this might ease the transition for some children when it comes to them going from a forward facing seat to a booster. And some high back boosters, you can take the back off and they can be used as a backless booster. So this is just another example of a backless booster. So whenever you use a booster, whenever you have a backless booster seat, or you use a high back and you take the back off and use it as a backless booster, that child always needs to be in a seating position that has a head restraint, because they don't have that head and neck support that is offered by a high back booster. So the seat headrest is going to provide them with that support that they need. And this little thing right here, this comes with a lot of backless boosters. It's called a shoulder belt positioner. You just use that if needed to just make sure that that shoulder belt is actually on the child's shoulder and not like up on their face or neck or anything like that. So I've talked about this. I'm not going to talk about this too much. We have our combination, our all-in-one. So this is a combination seat in forward-facing mode with a harness. You remove the harness. It can be used in booster mode. And then we have here our forward-facing harness, and then you remove that harness, and it can be used as a high back booster, or you can take that back off and it can be used as a backless booster. So these are some examples of those integrated booster seats. These are built into the vehicle. They are considered a part of the vehicle. Not all vehicles offer integrated booster seats. There's actually currently only 2 car manufacturers who even offer these, and that's Volvo and Dodge. Volvo has them in about 6 of their models, is Volvo XC90 being one, and then Dodge only offers it in select models of the Journey. So these aren't real common, and like I said, unless you have a Volvo, certain Volvo models, but it's literally just this little part pulls out. It helps boost that child up, and then you just buckle the seatbelt into them. And it's going to offer them that head and neck protection because, as you see here, it has the vehicle headrest giving them that. So the steps, once again, for choosing a booster are the exact same selection. Just choose the right booster seat that is most appropriate. So what we tell parents is children do not need to be moved into a booster seat until they are 4 years old and 40 pounds. So 440, 4 years old, 40 pounds before they need to be in a booster seat. There's also a few other factors, like if your child is an escape artist and you know that they're going to be unbuckling the seatbelt and get out of the car, it is perfectly okay to keep them in that 5-point harness until they outgrow it, the maximum weight limit of that 5-point harness. Direction, that's self-explanatory. A booster seat is always going to be used forward facing, never going to be used rear facing. Location, pretty much kind of some of the same things. It needs to be in a seating position that faces forward. Just check the vehicle owner's manual and the car seat manufacturer manual to make sure it can be installed in a location, a seating location that has those inflatable seat belts. And I saw my train of thought. I'm sorry. Okay. Yeah. So just check the vehicle's owner manual to make sure it can be installed with an inflatable seat belt. So adjust. So like I said, the purpose of a booster seat is to boost the child up to make sure that the seat belt fits them correctly. So you just want to adjust the booster seat because you just need to make sure that the child's head and ears and all that is protected, whether it be by the if it's a high back booster, by the back of the booster itself or by the vehicle headrest. And then securing the seat to the vehicle. So we tell parents all the time, the only thing that keeps a booster seat in the car is your child sitting in that car and the seat belt. So if you have a child that's in a booster seat, whenever they get out the car, make sure that they buckle that booster back in, because if you were to get in a motor vehicle crash, that booster is going to go flying because there's nothing keeping it installed in the seat if that child is not in it. So just make sure that you buckle the seat belt whenever a booster seat is not in use. Because like I said, that's going to be the only thing that's going to be keeping that booster seat secured to the car. And securing the child in the booster seat, that's pretty easy. Once again, you just put the child in the booster seat, make sure that they're all the way to the back of the seat. Buckle that seat belt. You might have to use, if it's a no back booster, use that shoulder belt positioner to make sure that the shoulder belt is actually on their shoulder, not in their face. There are some booster seats, especially if it's like a combination or all-in-one. So it's going to have those lower anchors. It's very rare that a booster seat is, like I said, unless it's a combination or an all-in-one, is going to be used with the lower anchors. But as we tell parents all the time, just check the car seat manual to see if you can install the booster seat using latch. And when it comes to booster seat, the 65-pound weight limit does not apply for latch because the seat belt is what really absorbs the crash forces, not the lower anchors. So this is that seat belt syndrome that I was talking about. So this is a correct placement of where the lap belt should be, but improperly placed lap belt. So the lap belt is up here on the child's stomach. So in the event of a crash, that's going to cause that seat belt is going to go right into their abdomen. That's going to cause some serious abdominal injuries, and it can also cause some spinal fractures. So basically that child's can just kind of go folding over that seat belt like an accordion. So that's why, once again, I say booster seat always needs to be used with a lap and shoulder belt. This is one of the biggest things that we see, a seat belt being used with a lap only belt. That's a big no-no. Also, we see parents moving their kids into a booster seat too early. So we've seen 2-year-olds in booster seats. The lap and shoulder belt is not used incorrectly, so it doesn't fit the child right. Or a shoulder belt positioner is not used with the backless booster as by the car seat manufacturer. So I just wanted to touch on this real quick. So a lot of people don't know this, but car seats do expire. They have an expiration date. So these are just some examples of where you might see. So you'll see here, this is the manufacture date, this is the expiration date. If you have a car seat that is labeled and it just has a manufacture date and it doesn't have an expiration date, they typically expire 6 to 7 years after the manufacturer date. This is just part of an industry practice, and some of the reasons for expiration dates, such as because the plastic shell and some of the other components can break down, and then over time they update performance standards and label requirements. But yes, car seats do expire, so keep that in mind. A lot of people are like, I never knew that. I would have never known that either. So when it comes to moving a child into a seatbelt, these are the questions that we ask parents. And if the answer to any of these questions is no, then your child should not be in a seatbelt. So basically, I'm going to kind of demonstrate. I hope y'all can still see me. So the child needs to be able to be sitting all the way in the back of the seat. Their feet need to be flat on the floor. Their knees need to be bent over the seat bench. And they need to be able to sit like this without slouching or bending over or anything. If they can sit like this and the seat belt is over their lap and correctly over their shoulder, they're ready for a seat belt. Like I said, if any of these are no, the child is not ready for a seat belt. So just a few reminders when using seat belts. So a lot of people, a lot of big kids, especially when they get out of a booster seat, they're like, ooh, I can ride in the front seat now. With the seat belt. Children need to stay in the back seat until they're 13 years old. And just remind them, they don't ever want to lean on a place where there's like an airbag, because in the event of a crash, that airbag is gonna hit them. Seat belts should never be shared. So we have our two little best friends here. No, no, no. No, just no. Seat belts are made for one person and one person only at a time. And you always want to make sure the child takes their backpack off before they get buckled in. So this child right here, these are some of the common errors we see. Children being buckled in with their backpacks, or the lap and shoulder belt not fitting them. Like I said, it's too far up on his neck. This is on his stomach. So they're going to take that, they're going to move it. They're going to put it underneath their arm, or they're going to put it behind their back. So this child is not ready for a seatbelt. This device right here is called a seatbelt positioner. So what this does is this basically adjusts the position of the lap and shoulder belt. These devices are not approved and should never be used under any circumstances. If you have to use one of these, the child is not ready to be in a seatbelt and still needs to be in a booster seat. So these are some informational resources where parents or any of y'all can go if y'all wanted some information on car seats, traffic safety data, statistics, healthy children. This is a division of the American Academy of Pediatrics, Safe Kids Worldwide. I mentioned them earlier. They are a nonprofit organization that focuses on childhood injury prevention. The National Highway Traffic Safety Administration, or NHTSA as we call it, that is a great resource. This is under the Department of Transportation, so it's a federal organization. Car Seats for the Littles. This is a nonprofit organization that is ran by child passenger safety technicians. The Car Seat Lady. It actually is a mother-daughter duo. One is a nurse and one is a doctor. They're both certified child passenger safety technicians. They teach. They're very well versed in car seat knowledge. The CDC, they have a child passenger safety section where you can go and get all kind of information on car seats and booster seats. And then carseat.org is a nonprofit organization that's dedicated to child passenger safety. So this is our contact information. So this is typically before COVID, as I said, this is the number this is our car seat line that parents could call. But right now, if you know anybody who has their own car seats and maybe has some questions or needs some help with installation, we have a few virtual options that we're offering. So y'all can write down this number, give it to parents or anybody you know, we can see if we can help them virtually. Or if y'all have any questions or anything you can think of, this is my email, danielle.weeks@childrensalabama.org. I'll be glad to answer any questions, concerns, reach out to me for anything. And if I can't answer it, my lovely coworkers will help me answer it. So I know that was a little lengthy, y'all. I'm sorry, but that is it.